welcome to The Acorn, the podcast that drops a little bit of psychoeducation so you can gain a better understanding of the therapy world and yourself. So without further ado, let's jump into our episode. Hello and welcome to Season 1, Episode 10 of The Acorn. Today, I will be interviewing psychotherapist Shanique Victoria Edwards about Black mental health in Canada. Welcome, Shanique.
Hi, thanks for having me. I'm so excited.
I am so glad that you are here, and I'm so glad that we get a chance to talk about this topic that is super important. So I'm going to just take a moment to brag on my girl a bit, okay? Shanique Victoria is a psychotherapist here in Ontario, Canada. She is a knowledge and translation specialist with the Cundill Centre for Child and Youth Depression at CAMH. She is a mental health consultant with Black Mental Health Canada, and she is a public speaker. She also serves on the steering committee for the Health Research Council for People of African Descent. Her areas of research focus are on racial trauma and mental health resilience. Shanique is a passionate advocate for the diverse and unique mental health needs of BIPOC individuals. Shanique, girl, thank you for being here and sharing your invaluable insights today.
Well, thank you so much for having me. It is a privilege and an honor, really. It is.
All right, so as I look at this topic of Black mental health in Canada, I really think it's important that I locate myself as a psychotherapist. So from my perspective, as a Black woman from Caribbean descent, there are many reasons why I would see that people who share a very similar background to me would actually refuse to seek out mental health supports. For some, there's a prevailing thought of, yeah, we just don't do that in our culture. For others, let's keep it real, they have tried to seek out supports, and they have been met with therapists who, due to a lack of cultural awareness or even cultural competency, have minimized their experiences. Mm-hmm. And that has actually done way more harm than good. Mm-hmm. And for others yet, economically, it's just hard sometimes to access quality mental health supports. So that's the lens that I'm looking at this through. Mm-hmm. However, Shanique, you have looked at the research and you know from your perspective what is actually impacting Black Canadians. So what are some of the major barriers for Black Canadians when it comes to accessing mental health care?
Yeah, I think you touched on, many of the ones that are actually popping up in research, to be honest. I will preface by saying, unfortunately, within the Canadian context, there is not a lot of race-based data. And so a lot of the data that we are pulling, from the research to speak about the Black context is mainly based on, the American context, which is, not that it's 100% different than that of the Canadian. It looks different for sure. Mm-hmm. But, Canada does have its own history of colonialism, of slavery, things like that we don't really talk about overtly, nor do we really shed much light about its impact even on later generations. Mm-hmm. But we do know it's very overt within the States, right? And so their kind of explanations and their experiences will be slightly different than ours, and as well as from the UK. The UK has a lot of race-based data. However, what we are seeing is that stigma plays a significant role in just apprehension, for many Black people who enter into mental health care, especially Black men, their routes to mental health services oftentimes are by way of incarceration, right? And so adding a trauma like that to then kind of, trying then to open up the door to mental health support that is not culturally affirming, that is not safe, that it does not take into consideration our historical and our cultural context, can also do a lot of harm. Yeah. As you mentioned as well, cost is a significant barrier. There have been many studies that highlighted, COVID-19 was so detrimental, just overall to the well-being of Black people and specifically financially. Mm-hmm. And so, we're asking people to, shell out hundreds of dollars when they're finding it very difficult to put food on their table. And as you mentioned, even if they are able to shell out those hundreds of dollars, They may not be getting adequate, therapy. They may not be getting therapy that is, again, culturally affirming or culturally safe for them. Mm-hmm. And they may be seeing a therapist who just, has not even done their own work on themselves. Mm. And so that could be contributing as well to trauma. And I would say, the other thing is, in regards to access, is that we do find that there are kind of, readily available services in communities other than our own. Mm-hmm. Right. And I mean, I'm glad to see that there has been some changes with that. Peel just opened up a Black-centered health center, which does have, one of their programs is focused on mental health. But that is, one community of so many, where, Black people desperately need it. And I think as well, our understanding of mental health and our presentation of mental health is a lot different, I would say, than what is portrayed in mainstream media. Mm-hmm. I think myself, coming from a Caribbean background, I'm sure there were times when my mom, for example, I grew up in a single parent household, and I'm sure that there were times when my mom was depressed. Mm-hmm. I mean, now as a therapist, I could clearly see that there were times when perhaps her life and things that were going on with her made her depressed. Mm-hmm. But she still got up and she went to work. She didn't have the luxury of being able to stay at home and taking time off. She mm-hmm. still had to parent. Like all of these different things where individuals from our community who may be having mental health challenges may be very high functioning. Mm-hmm. And so some of these kind of prescriptive ways of analyzing symptoms, we don't fit sometimes within mm-hmm. these boxes. And so for us, it's kind of like, maybe it is not mental health. Maybe it's just that I just need to, trudge along, or, maybe I'm just having a bad day, because we don't necessarily have that language as well within our community. Mm-hmm.
I love that you just touched on that fact around like high functioning depression amongst Black women, because a lot of the language that even we get that we then internalize is around strength. We have to be strong. We have to be strong for our families. We have to be strong for our community. We have to be strong for everyone around us. And so, that then is giving that message that we can't take that break. And so when we have, especially with the research in North America, where it's looking at these factors of depression, this is what depression looks like, but it doesn't then translate through that cultural lens. That's hard, right? That's hard. Mm-hmm. And so it's like, I love the fact that you just highlighted that, because that's an important factor. It's an important piece.
Because representation matters, right? Mm-hmm. It's hard for us to say we're going to go and access a service that we don't even feel like we identify in. Yeah. Right? And so when we're not seeing representation of what it looks like and how kind of mental illness or even mental well-being, how that presents in our community. What does it look like to actually be operating at your best self mentally, right? For our community. That's not something that, at least, for me, was ever really, kind of tabled. And so when I was having kind of my own personal off times, it was really hard to kind of identify myself, because a lot of the constructs were not made for people whose lives are like mine, simple things like having to coach switch, right? Mm-hmm. Even in high school, and the pressure that comes with that, and not really kind of understanding and being able to acknowledge that, okay, I'm not okay with this. Like, I'm not feeling okay with this. I know it's something that I may end up having to show up and do, but it doesn't feel good. So, how can I, be kind to myself? How can I support myself? What does that support look like? Where could I find it? Mm-hmm. Those types of conversations that I'm hoping that, as we progressively move at having more of these conversations, that the younger generation will be able to have a bit of that representation.
Mm-hmm. And I think you're right. I think the younger generation, they are having those conversations a little bit more. And I'm so grateful for that when I see that happening. Yeah. And so we touched on a little bit non-BIPOC therapists. And if someone is out there and they're like, you know what, I do want to be able to support Black Canadians, how can they do so with even more cultural sensitivity in their own client care?
Mm-hmm. I mean, I think first and foremost is identifying that you need to do this work. I think that's the first hurdle, right? There's a lot of people, especially within the Canadian context, color blindness is a big thing in Canada, right? We don't see color. But for you not to see color specifically in your clients is for you to deny a significant part of their identity because they operate in a world that does see color. We operate in social systems